Hello everyone, welcome to WH Medical Courses. This is a quick video today on the Ottawa Ankle Rules. Now, what's the need for the Ottawa Ankle Rules? Essentially, these are guidelines to help reduce the need for exposure to x-rays in ankle injuries. So imagine you're a healthcare professional working within the emergency department and you want to establish whether this patient has got a fracture or not. So these are guidelines, and essentially they're used for patients that are over 2 years of age and they have over a 97% sensitivity to identify patients with a fracture. Now, what are they? There are 4 Ottawa Ankle Rules. If any of these are positive, then the patient needs an x-ray, obviously using clinical judgment, of course. Now, the patient, number 1 is that the patient's unable to weight bear after the injury and in the emergency department. Number 2 is there's bony tenderness on the posterior aspect of the medial or lateral malleolar area and then going up to 6 centimeters above the malleolar area. Number 3 is that there's tenderness at the base of the 5th metatarsal. Number 4 is that there's pain at the navicular bone. So again, if any of these are positive, they need an x-ray. Now, just for people that are more visual, there's a representation here of where the 5th metatarsal is, where the navicular bone is, and where the tibia and fibula would end up to make the medial and lateral malleolar areas. Remember, going up 6 centimeters above. So if any of these are positive, patient then needs an x-ray.